our community has been facing a lot, and it's really undescribable right now to share a lot of what's going on, And obviously, yes, we're afraid to go and get tested and not knowing if immigration agents are going to be there doing their work, So it is very, very hard. And what I picture that it could happen is that because of that narrative, people won't get tested, and we won't be able to control infections. We won't be able to control a bigger issues, and then he's gonna start using us as he's gonna put us as responsible for whatever happens in the future. So. It's a lot of questions, and that creates insecurity, fear, and emotional instability. And it creates. I think, in my understanding, it will create a bigger impact if people get infected and they decide not to go because of these attacks by this administration.
What we saw in 1994 with the passage of Proposition 187, which was to deny public health services to immigrants, undocumented, is that immigrants in general, undocumented and documented, were reticent to go to public health services. This had a long-term effect. The problem here is even more urgent because now we have a pandemic. This isn't something about flu season or maybe even a tuberculosis hotspot. This is something that can affect us all when we're seeing that one person can affect, the estimates are 1.5 to 3 people. If we don't tell the undocumented population and immigrants in general that they will be safe, this will be a pandemic that won't just affect the undocumented, but anyone that they have ever come into contact with.
And also, I want to let you know that
I think it is very dangerous that for the undocumented community who may be unwilling, unsafe to feel unsafe to go for help, that they could actually suffer the worst of consequences, which is really peril to their life. The undocumented community is not protected in the same way when it comes to access to health care. They are fearful of their immigration status being discovered, and so they're very vulnerable at this moment.